Okay, go.
Very good. Okay. Hi, my name is Dr. Paul Rega from the Department of Public Health and Preventive Medicine from the University of Toledo, and to my left is...
I'm Brian Fink, also from the Department of Public Health and Preventive Medicine.
And you may be wondering what we're doing. And what we're doing in cinema verite style is to demonstrate a little bit about active shooters and a specific attention to the healthcare environment and the healthcare provider. So we have three objectives. One is to summarize active shooter strategies. Number two, talk about the dilemmas associated with healthcare providers in the face of an active shooter. And number three, demonstrate for you one of the possible improvisational weapons that you can use to help defend yourself when an active shooter comes into your space.
Right, so really, with an active shooter, you really have three potential options, and we're not advocating that you pick any certain one. The idea is that you make your decision quickly, and with training you can do that. Your options really are to run, to hide, or to fight. With running, the idea of course being that you try to escape if possible. But that's going to play in a lot of factors, knowing whether, where the active shooter or shooters are in proximity to you. And with a healthcare provider, as we kind of mentioned earlier, the possible dilemmas that could take place, that you're not just responsible for yourself, you're responsible for your patient or patients, as well as your fellow colleagues, their family members. So there's a lot of safety issues that go involved with the potential of running.
Exactly. In many environments, or in many people have no problem with basically they hear the active shooter and they run because they have no other responsibilities other than to themselves. But we as healthcare professionals already are imbued with a sense of responsibility to our patients and the patients' families. So we have this dilemma, this conflict. And basically we address the conflict so that at least the healthcare provider can at least think about it and see what they would do. But in this kind of a setting, many times the patients are going to be incapable of making decisions for themselves, or they're too sick to even get up and run on their own. So hiding may be the option that the healthcare provider may choose. And if that's the case, then basically we get into the third category, which is fight. Okay. In the meantime, what we do is turn out the lights, we mute our cell phones, we gather any other weapons we have in the room, which could be intraosseous needles, trauma shears, oxygen tanks, defibrillators, intraosseous needles, all those kind of things that you can possibly use, your shoes, anything that you could possibly have. But we also have discovered another one which is very not well known, which we can find in any kind of orthopedic room. So we'll go over here and show that. As Brian takes care of our active shooter, I will demonstrate for you what we're talking about. So you hear the sound of the active shooter. Again, this is cinema verite, so basically hang in with us here. Okay, you want to get plaster pads. These things cost no more than several dollars. And in hot water, you want to get it as hot as possible. You want to go ahead and insert that, and you want to go ahead and mold it into a snowball. With hot water, this thing will set within a matter of a minute. You can throw in multiple ones as you're creating all these weapons. Okay, as this goes on, basically we take this, I mold it, okay, and just set it aside and doing multiple ones. This one is one that we already have in order to save time. And basically we're going to go ahead and we have it right here, okay, and basically Dr. Fink is going to go ahead and
just you can have multiple ones of these and just throw it.
And hit the assailant.
Right.
With no problems. And that's basically the situation. We want to basically thank you for your attention to this. And we also want to give credit to Janice Brown, who is our cinematographer, who's been moving that camera and making you dizzy and nauseous. And we also want to thank Dr. Martha Sexton, who is the professor in the College of Nursing, who allowed us to use her nursing simulation center. Any final thoughts?
I would like to mention just with the plaster splints is that even you don't have to just have them in an orthopedics room because they are so cheap. You could put these, a few of them in every room, whether it's a clinic or lab, anywhere, and so that way they're on hand. Quickly, you can make improvised weapons anywhere. So.
So that being said, I think we're finished, and thank you for your attention, and have a good day, and be safe.
Thank you.
Bye.